Hello, Arlinda. My name is Tiffany Grice, and I'm here to try to get your support for Bill 342, nurse midwife ultrasound procedures.
Okay.
Have you heard anything about this bill?
I've heard a little bit about it. It had come up for amendment, but I didn't get much of the details of it.
Okay, well this is just a revision to the current bill to allow nurses to provide safe patient care. There's been some misinformation about nurses' use of ultrasounds that may have been sent to you. But in fact, nurses and nurse midwives do not perform the type of diagnostic ultrasound done by sonographers. So, in fact, the amendment placed on the bill is in the Senate Judiciary, specifically saying that nurses shall not perform diagnostic ultrasounds. Nurses have tried to negotiate with the ultrasonographers for the past 18 months, but haven't been able to come to an agreement. So what the amendment of this bill will do will allow nurses and advanced practice nurses to continue doing what they've been doing now since 1970, since it's been in the nurses' toolkit. And they will be able to provide bladder scans, find veins on difficult to stick patients, as well as check positioning of fetuses when in prenatal care. So nurses have been performing ultrasounds for decades at the bedside. Nurses are with the patients 24/7, 365 days a year. Like I said, in the middle of the night, when a patient needs an IV, a PICC line, a focused assessment, pulses checked, bladder scanned, or labor starts, nurses are there. And if we had to wait and get the sonographers up there to do this type of procedures, it could delay patient care. Across the country in all 50 states, these tools are available to nursing for care of their patients. Nurses using ultrasound is not a practice change. There's no change in standards. And at the largest hospitals in the state, nurses perform over 5,000 procedures a month using ultrasound safely, efficiently, and cost-effectively. 30% of the deliveries in New Mexico are performed by nurse midwives. And also, for the safety of the baby and the mother, nurse midwives need this tool immediately available. It is not part of their curriculum and education. It isn't new. They've been taught how to use this equipment since the beginning. So why would we return to an age of painful or riskier procedures simply because ultrasonographers are finally getting aboard to regulate their practice? Healthcare does not need another added expense for something that's not broken. So because of these reasons, I'd really like your support in amending this bill.
Okay. I'll take a further look at it, but what you've presented sounds good.
Okay, thank you for your time.
You're very welcome.